This is Professor Pope with a supplemental video supplementing our class from Tuesday, November 30th, 2018. We were talking about the liability of healthcare entities, and a very good question was brought up in class, and I intend this video to respond to that question. So this is a very specific and focused short video. The question that was asked is, do the locality rules, and we talked about 4 of them earlier in the class, do the locality rules that we discussed in connection with the standard of care for clinicians also apply to entities? So we discussed earlier in the class the strict locality rule, which used to be 30 or 40 years ago, common, now exists only in Idaho. We talked about the strict locality rule. We talked about the same or similar community rule. We talked about states that have a statewide standard of care, and we talked about, of course, the dominant rule, which is the nationwide standard of care. So we talked about that in the context of medical malpractice. When it's a individual clinician defendant, that the standard of care that they have to comply with has this geographical component. So it's the duty is defined as what the reasonably prudent practitioner, and fill in the blank with the geographical limitation, would have done under the circumstances. So the question is, do those locality rules apply to entities as well? So the answer is generally yes, they do apply to entities in much the same way that they apply to individual clinicians. So let me just give some specific examples to illustrate the point. So remember that the majority rule for clinicians, so most jurisdictions, the standard of care for a physician is what the reasonably prudent physician in the United States would have done under the same circumstances. And we saw that there may not really be variations in what the standard of care actually is, from Mississippi to Virginia to Idaho, but there definitely is a variation in how a litigant would prove what the standard of care is. So it's an evidence rule, right? And it defines who is a qualified expert witness, which of course is the vehicle through which you would introduce the evidence on what the standard of care is. And similarly, just as the nationwide standard of care would apply in those states that have a stricter locality rule, something smaller than the entire United States of America, if they have a stricter locality rule for clinicians, then they generally are also going to have that same stricter locality rule for entities as well. So let's take Idaho as an example, starting with the strictest type of locality rule. So this is the Idaho statute that I obviously just pulled off the legislature's website. And you can see that the standard in the larger highlighted box is, right, the plaintiff must prove by competent evidence that the defendant negligently failed to meet the applicable standard of healthcare practice of the community in which the care was allegedly provided or not provided, right? So it's defined by the community. The standard of care is defined specific to the community where the care was provided. And then in the smaller highlighted box, you can see that that applies to hospitals and nursing homes, as well as to a whole bunch of individual licensed clinicians. So, um, and the answer is yes. The locality rule that applies to an Idaho physician also applies to Idaho healthcare facility. Let's look at Virginia, which has a slightly broader locality rule. So it's not specific to the community in which the specific community, like Idaho, where the care was provided, but to the whole state of Virginia. So here's the Virginia statute from their website. And you see that the standard in the larger highlighted box is acts or omissions are to be judged by that degree of skill and diligence practiced by a reasonably prudent practitioner in the field of practice or specialty in this Commonwealth. So it's that phrase, that three-word prepositional phrase is what limits, right? It's not just practiced by a reasonably prudent practitioner in the field of practice. It's those words in this Commonwealth that limit it to make it a statewide standard of care. And again, you could see in the smaller highlighted box, this statutory definition of how the standard of care is proved, or breach of the standard of care is proved, applies not only to individual clinicians like physicians, psychologists, podiatrists, dentists, nurses, but also to hospitals and other healthcare providers. And then one more example, Washington state, right? Like Virginia, also a statewide standard of care. So the Washington statute here from their legislature's website says, right, that the healthcare, that if you're proving breach, you're proving negligence, that you need to prove that the healthcare provider failed to exercise that degree of care, skill, and learning expected of a reasonably prudent healthcare provider at that time in the profession or class to which she belongs in the state of Washington, acting in same or similar circumstances. So again, it's that in that state of Washington, which defines which reasonably prudent healthcare provider are we measuring the defendant against. Now, this statutory definition of the standard of care tells us it's a statewide standard of care, but it doesn't answer the question that was asked in class, which is, does this apply just to individual clinicians, or does it also apply to healthcare entities? Because they use the word healthcare provider, and it's not clear if healthcare provider includes both individual clinicians and entities. But if you look at some adjacent sections of the Washington Revised Code, we see that there is a definitional section a few sections up, and it says in this chapter, healthcare provider means either, and it gives a few things. It can be an entity, whether an unincorporated facility or institution employing one or more persons described above, including a hospital, clinic, HMO, or nursing home. So again, the locality rules, the geographical locality rules in all their four flavors that we discussed earlier with respect to individual clinicians also apply to healthcare entities if they are the defendant. So note that this doesn't matter if we're talking about vicarious liability of the healthcare entity, because if the only theory of liability against the entity is vicarious, then we wouldn't have needed to answer this question about the standard of care, because in vicarious liability, we're not actually alleging that the entity itself committed any negligence or was negligent, right? We're only saying that we proved that an individual clinician was negligent and that you are responsible for paying for that liability. But in vicarious liability, we're not actually asserting or proving that the entity itself was negligent. So the question that was asked, do the locality rules apply to healthcare entities, is really only a relevant question And the answer that we just gave is relevant only when we're talking about direct liability, because then under a theory of direct liability, then the plaintiff is actually asserting and trying to prove that the entity itself was negligent and therefore needs to know what is the applicable standard of care to which the healthcare entity should have complied. So just to fully unpack it, well, just to quickly apply the rules that we just saw, right? If you're suing a Boise hospital for negligent credentialing, negligent selection, negligent retention, or maybe their equipment was not sterilized appropriately, right? You're talking about negligence of the hospital, direct liability. A Boise, Idaho hospital must act in the way that a reasonably prudent Boise, Idaho hospital would have acted under the circumstances. A Richmond, Virginia hospital must act as a reasonably prudent Virginia hospital, right? It's not, doesn't have to be Richmond specifically, but it has to be Virginia. And we remember from the Hall versus Hilbun case that Mississippi adopted the national standard of care. So Jackson, Mississippi hospital must act as a reasonably prudent U.S. hospital, national standard of care. And just as a reminder, under the national standard of care, that Jackson, Mississippi hospital could still argue that it doesn't have the resources. And if the reason for deviating from the standard of care is related to resources, it might not be, it might be due to bad judgment or skill on the part of one of the clinicians. But if it is due to resources, then they can argue that they should have even under national standard of care, that they should be allowed a deviation from the standard of care on the basis of limited resources.